Oral isotretinoin shrinks sebaceous glands and reduces oil production by 80 to 90%. So if you're on this medication, the likelihood you'll develop dry skin is extremely high. In fact, that's one of the ways dermatologists evaluate whether patients are actually taking the medication. They check to see if there's skin dryness or lip dryness. How can we help mitigate this type of problem? How can we reduce the dryness of your skin, your lips, your eyes, your nose when you're on this treatment? I have a few tips and tricks to help you. I'm Accutane. I'm a Canadian dermatologist with 35 years experience in treating acne and doing research on this condition. I'm here to help educate and inform you. Let's start with gentle skincare and cleansers. Avoid soaps. They can strip your skin of your natural moisturizing factors. They're the wrong pH. They often have products that emulsify your oils and remove it so that you have squeaky clean skin. Squeaky clean skin is not a good thing. The squeakiness means you've lost all of your surface oils and protective layer. The second part is you want to use gentle cleansers called synthetic detergents. These are the right pH for your skin. They have very gentle cleansers that don't strip your natural lipids off of your skin surface. The third part is use moisturizers and use them frequently through the day, applying them all over your face. The important part about these moisturizers is frequency of use and to ensure they have the following ingredients: panthenol, hyaluronic acid, glycerin. All of those can help to pull in moisture and keep it on the surface of your skin. The drier your skin, the more you're going to need a thicker moisturizer. Let's talk about lip dryness. At higher doses of oral isotretinoin, lip dryness is a very significant issue. That's why I don't use high doses. Let's look at how to prevent that with proper moisturization of your lips. The first is use ointments, not creams. The creams are too light for your lips. Remember, your lips don't have a lot of oil glands, and the few they have are no longer working as well when you're on this particular medication. So moisturize, use it frequently, 4, 5, 6 times a day. More is better, not less. The important products you're looking for are petroleum jelly, Aquaphor ointment, CeraVe healing ointment. All of those products and many others can be extremely soothing to mitigate the dryness for your lips. What about your nose? The drier your nose becomes, the more at risk it is of developing nosebleeds. Here's how to help. Apply a small amount of petrolatum or Aquaphor to your nose, inside your nose, and squeeze it to distribute the product inside your nasal passages. And just a thin layer is enough. You don't have to put so much so that it feels uncomfortable. The other option is to use saline gels or saline nasal sprays, and consider using a humidifier, particularly in your bedroom during sleep, because that's when you're going to be needing more humidity. Isotretinoin can reduce the secretion from your meibomian glands. These are the oil glands around your eyelids that normally help produce the oils that help to stabilize your tear film. So patients may notice dryness, you might notice irritation with contact lenses, you might have a gritty sensation. It's important to use lubricating artificial tears. If you wear contact lenses, you probably have comfort drops, and the effective ingredient you're looking for is sodium hyaluronate. And these products can be used very, very frequently, and use them to keep your eyes as comfortable as possible. 2 other tips that may be of help to you. One is to use these cleansers, gentle cleansers, the moisturizers, the lip products, and so forth, a whole week or 2 before you actually start the medication. And typically, while we are waiting for the blood test to be done, you'll have that period of time where you can initiate these moisturizing gentle care habits. The second is to consider taking supplements of omega-3 fatty acids. And here, 1 gram per day or more can be helpful to reduce some of these dryness signals that develop from oral isotretinoin. Remember that the dryness from isotretinoin is not a complication. It's a signal that the medication is doing its job in reducing the function of your oil glands. The key, though, is to protect your skin barrier before irritation develops. And these few tricks and tips should help you be as comfortable as possible while the medication works to clear your acne. I hope this is of help.